Welcome back to Behind the Numbers. This week we welcome Dr. Adrienne Stevens, the Managing Director of Cochrane Canada. Cochrane is a global leader in the production of high-quality systematic reviews, and Dr. Stevens chatted with us about the difficulties of research during COVID and the process of navigating the literature to ensure that we are getting our information from high-quality publications. Dr. Stevens expands on the differences between rapid reviews and systematic reviews, as well as the many ways that Cochrane is doing its part in combating COVID-19 and how this is helping the healthcare field, policymaking, and the general public. Enjoy. All right, so welcome, Dr. Adrienne Stevens. I'm very excited to have you on the show. Thank you for joining.
Oh, thank you for having me.
So first, I want to actually congratulate you on your recent appointment as Managing Director of Cochrane Canada. You really started out during unprecedented times.
And sure, that's the case. But, because I've been involved with Cochrane for a long time and the group's been great just to kind of, jump right into what's going on. So it was a really easy transition for me.
So most people listening to this will know what Cochrane is, but just in case, so it's an organization that basically promotes evidence-informed health decision-making through systematic reviews. And it's this massive database for it. But over the past 2 to 5 years, there's also been this exploration into rapid reviews, which we'll touch on. But before we get into that, could you give a brief little differentiation between systematic reviews and a rapid review?
Sure, no problem at all. So for those of you who are familiar with systematic reviews, then you would understand it as, sure, it's a set methodology. The idea is to be systematic, to be able to reduce bias when you're looking at answering questions for decision makers. And so you would think of it as, yes, you have to come up with your question, and that's a very structured, if you think about a PICO sort of style, right? Who's your population, intervention, comparator, and outcomes. And from there, then deciding, okay, so where should we be looking for relevant information? Then once we've done that search, then applying those criteria to see, which is relevant to actually answering the question. Then you're harnessing information from that process, appraising it, analyzing it, and then coming up with your final report. And so we would understand a systematic review to take 6 months, 12 months, potentially longer, right? Depending on the volume of information, depending on the size of the team, really, that's undertaking it. And so if you think about a rapid review, the idea is, okay, well, sometimes there are pressing questions that can't wait 6, 12 months or so for information. And so you have to think about a methodology that there's still confidence in and comfort in to be able to get to it, to avoid bias as much as possible, but then meets that time demand. And so enter in rapid reviews, really. And so the idea is, you've got a methodology that, you think about some flexibilities because you have to think about the topic. You have to think about what's doable, feasible for the timeline, and then how you're going to go about it. So there are concessions in the process of a systematic review to be able to get to that information. So that really is it in a nutshell.
Perfect. Thank you for that. And I know in 2015, Cochrane established their Rapid Reviews Methods group, within which you're a co-convener. And then in 2018, you started this path of exploring rapid reviews, which time really couldn't have been better in terms of us now being in the midst of COVID. And I know a big question or potential confusion or worry is how to navigate the information that's coming out and the research that's coming out. And I know with your group, you had put out a paper that was published in the Journal of Clinical Epidemiology, and it sort of gave these 26 recommendations of what you want in a rapid review to make sure that it can be of high quality. But then shifting from not only you writing a rapid review or putting one together, how do you look at a paper and assess through COVID times that I know everything's being expedited so much. How do you navigate these papers and ensure the high quality when you're looking through it?
Yeah, for sure. And I think, COVID is an interesting challenge, right? In part because there's information that's continuously being published and emerged. And so I think you're thinking about rapid reviews, but then you're also thinking about then being timely with it as information emerges. And I think what we're seeing too is we're seeing groups who aren't just doing a rapid review once, right? They're looking at updating. Some of them are actually looking at taking it into the living phase. And so what a living phase is actually having that commitment to a continual look for new information as it emerges, so that their synthesis of the information then can keep in step with that. So I agree with you in that it was very timely for us to be able to put the methods together for Cochrane to be able to then, to be able to tackle the pandemic.
Because that's been something, you go to bed one evening with certain ideas of how to manage it, and you wake up and there's already new information about this virus. And there's that constant ongoing need of how to inform policies with this information. And can you tell me, from the perspective of putting together reviews, are there specific ways to sort of quickly assess, is this a high quality publication or not? Or what material can I take from this that might help with other things, but overall the study might not be great?
Yeah, I think you're still doing evaluation. And that's where I think it comes down to what tools do you have at your disposal to be able to expedite that. One tool certainly is having an experienced team. Mm-hmm. And so, we would suggest for people, undertaking rapid reviews, you really need to have people that experience. So you certainly want to have someone on your team who has rapid review experience. And if not, you have a methodologist. So I've consulted on a rapid review that's been done through Cochrane, but certainly having folks who've been through that process, and having experienced systematic reviewers, because again, it's being judicious about what shortcuts you make in the process. Again, thinking about what makes sense for that particular topic. So that's one piece. So it's the human sort of personnel piece. Then there's also other tools at hand to be able to expedite it. So, you can use Covidence, for example, and Cochrane would be an example of a tool, and certainly having a team who's been used to using Covidence. There are other tools as well. Some folks use Distiller, SR, et cetera. So I think, again, those pieces take away from, that time that you would otherwise spend having to sift and sort and do things manually to, again, be able to hit the ground running.
And between different rapid reviews, the way that you may shorten the length of time that it requires, is it the same? Like, are the steps the same in every single rapid review of where you're cutting out the time, or does it change dependent on what you're looking at, what sort of studies you're putting together?
Yeah, I think it does really depend on what your topic is. If you're looking at a topic that is maybe more complementary medicine, you would want to make sure that you're tapping into Asian literature. And certainly was the case with COVID, because a lot was emerging from China, et cetera. Mm-hmm. And so it's really important to be able to have, that information. Again, you're thinking about, at the end of the day, how can I make sure that my rapid review is as informative as possible, and minimizing, what the risk is of getting the answer wrong. And colleagues out of Cochrane, Austria actually had conducted a survey of guideline developers and health policymakers to find out they were only willing to risk a 10% chance of getting it wrong. And so for me, that's a big piece informing about, okay, they do take this seriously as well, methods, right? So being able to inform our process to try to, again, minimize that risk as much as possible.
Yeah, that's a nice statistic you mentioned, that although it's being expedited, it's still being kept at a very, very high standard. It's not like we're staying at 50% possibility of it being right or wrong. Like 90% is still quite high in terms of the possibility. And what I really appreciate about Cochrane is that we all know the scientific community can be quite competitive, but I appreciate that the mission as a whole is so collaborative, and it's really working to facilitate the production of this high quality evidence-based research, not in terms of only what you are putting out as an organization, but as well as in assisting others of how to keep it up. And this didn't end with just the rapid reviews. I want to talk about the recommendations map, which I think is a fantastic tool. And if you could sort of touch on that and expand on that, I think this is going to be amazing for everyone to see.
Sure. And just to start out to say, this wouldn't be possible if it wasn't for the support of the Canadian Institutes of Health Research. And so they launched a call in May. We had 2 weeks to turn around, and we ended up putting a very large team together, and then found out we were funded in June. And so we were able to hit the ground running. And so the idea behind this is it's a one-stop shop for recommendations and guidelines related to COVID-19 and to any topic, quite frankly. So it's not just treatment, it's diagnosis, it's thinking about prognosis, health systems, health services, and so on. And so the idea is we have this large international team, and it's colleagues of ours who span, they're from various places across 6 continents. And so we have, folks representing low and middle income country regions. We have, our Cochrane network through Canada is involved with this. We have various knowledge users and partners such as the World Health Organization, the Pan American Health Organization. We have representatives from here in Ontario, where I reside and where the Cochrane Centre is, along with national public health representatives, again, to be able to work within this. And so the idea is we've put together this portal, and it's freely accessible. It's online. And so it really is geared to anyone. It could be, it could be health policymakers, it could be clinicians, researchers, and the general public, really. So the idea is, folks can access this portal, search for information related to COVID-19. We have it also organized according to a grid. And so if you wanted information on masks, you want to know what the effectiveness of masks is, for example, you can look at that. There's clinical questions even, looking at anticoagulation is an example of one where they've noticed that, COVID patients have a higher tendency for thrombotic events. So you think about pulmonary embolism or a deep vein thrombosis. So what should clinicians do, right, when a patient like that presents to a hospital? So it really is intended as a one-stop shop. And so they can access the recommendation. They can have a sense of the quality. So we quarterly appraise it as well, what the certainty of the evidence is. So how much confidence should we be placing in the results? For where data exists, then, information underpinning that. And in addition to that, so, we're putting this together. We actually get to launch it on Monday. So we're so very excited to be able to share that with everyone. But coming features include what we call an adultment module. And the idea is for, folks in various places globally, you can decide, you can look at a recommendation and say, okay, what does this mean for my area or my jurisdiction or for the people that we're trying to serve? And you have an opportunity there to look at the evidence and say, okay, well, maybe there's other considerations we need to think about. Maybe values and preferences are different for the people that we serve. Maybe it's an aspect of feasibility or acceptability of the intervention. And so we have link outs to different portals, actually. And so the Epistemonicus Love platform is, again, it's the, what's the evidence for COVID-19? You can link out to there. They have filters for users to be able to access. So if you reside in Peru and you want to be able to do be able to adjust the recommendation for who you're serving in Peru, you could say, well, is there local Peruvian information actually to be able to inform this? So then what you do is it actually does a stepwise process of being able to take into account any of that additional information, and then in context of the evidence and say, okay, what does the recommendation mean for our area? And so folks can go through that and then actually contribute it back to the map. So you have the original recommendation, and then any of those adjustments, or what we call adultments, can also be made available too. So we're actually quite excited. As you can tell, I'm a little bit passionate about this.
No, it's fantastic.
We are very excited.
Yeah, no, it's an absolutely fantastic tool. And I was playing around with it a bit as well, looking into it. And as you mentioned, the fact that it's so globally available and relevant. I mean, you can look, even now I'm just playing around with it. And let's say, for example, vaccination, that's a very big topic right now. And you can choose whether you want to look at vaccination and old age, or vaccination and Indigenous, or vaccination and healthcare professionals. And you just quickly pick it on a map and click it, and it gives you the information, as well as, like you said, how strong the evidence is, or it even highlights if it's not strong evidence, which is great to know. Again, if you're thinking, okay, well, do I maybe use this, or should I proceed with extreme caution when I'm using these recommendations? And it's, as you said, for general public healthcare, like anyone who wants to know absolutely anything about COVID, it is so easy to use and so easy to look at and easy to lay out. And you don't have to sift through, say, 1,000 papers and their full abstract and methods. Like, it's right here, quick and easy to see. I'm getting excited.
Well, I'm glad to hear that. That's great user feedback. I appreciate that.
No, I was really enjoying, I was so impressed with it, because again, even when you're looking at other platforms and you just have, say, I'll compare it to the average Google Scholar, and you get thousands of papers and you're sifting through and you're like, how do I know which one is good, which one's not? And this makes it so easy. And the amount of effort, I can't imagine that your team and all the teams that are putting all this together and sifting through the information, it really is incredible. And I'm excited that it's launching on Monday.
Oh, that's great. Yes, it's been a labor of love for us. And again, have to just, shout out to, we have this great international team of researchers who have been, committed. I mean, we've been meeting weekly since mid-July to think about this, get up and go. And as much as we were able to hit the ground running, I mean, it's been great to have this team who have been, just there to be able, as a sounding board, to be able to, inform some of the ways that we've been navigating this information. And, and I'm pleased to say we will have papers that come out of this forthcoming, because it's been helpful just even from a scientific and methodological perspective to be able to move through this. So, but yes, I mean, our desire and our heart here is we really want people to be able to use this. And so being able to disseminate as much as possible, because we really feel like it will help impact decision-making and be a big support.
Absolutely. And not even for just within this pandemic. I mean, even later on, a trip, like using it for other scenarios or other, not necessarily just this virus, but any disease or any condition, to make research this accessible for any person, I think will really help combat the constant both misinformation and disinformation movements that are going around. And there's this constant extremist, almost like battle of what really is true. And this lays it out so easily for everybody. And do you think that these sort of tools will, do you think these will be something that you'll amalgamate into other things after COVID, as we hopefully get through it? I'm going to knock on wood, because I said that early in the summer and here we still are, but
yeah, I mean, that would be our desire. So as a lead into this work with COVID, actually, our team has been working with the World Health Organization and had developed, a similar recommendation map surrounding tuberculosis. So again, with the idea, it was a one-stop shop for WHO recommendations on TB. We would love to see this rolled out with other groups and other organizations, because as with many guideline groups and organizations, there's a multitude of questions and therefore a multitude of recommendations. So why not have them housed all in one place? As you're saying, to make it easily accessible to the information.
Yep. And between different areas or different populations, to have those guidelines at the tip of your finger, so you're not wondering if someone new comes in, say a traveler comes in from another country, and you wonder how might where they're from affect what's going on here. And it's so easy to pull up. Sorry, I'm rambling about this topic as well with you. I'm so excited about it.
Oh,
that was one of the things even through this podcast. And I was so excited to have you come on and speak, because such a big thing, even within those who I'm in my program with, it's just how do you put the information out in a way that not only professionals in the healthcare system or students in the healthcare system, but like how can you get it to everyone in the generic population to learn about all this and to really trust in public health, because that has been a big struggle, I think. And that's something that is great with your constant, how should I say, like push for high quality research, because I think the past few months have sort of been tough in terms of public perception of healthcare. And the constant changing of, I mean, you'd think you want policies to change on a daily basis, because it means we're learning from our mistakes, but it's tough balancing that with then people thinking that you don't know what's going on,
That's right. And I think there's an aspect of science that maybe that the general public just isn't aware of, and that especially in context of COVID, there is a continual learning, right? And we've even learned about long COVID, even the discussion of, how long is immunity conferred for, right? Or, sustained for. And so those are all pieces that are merging and learning. And I think there is a sense that for those who maybe aren't aware, that just not, I guess, maybe understanding that aspect, always thinking of science as truly black and white. I think,
yes,
to a certain extent, rather than it being an emerging and learning, and everyone's growing in it. So yes, that is the reality, that's for sure.
Yeah, well, this is fantastic work. And in terms of overall, not just Cochrane Canada, but Cochrane, the full organization, the work you're all doing is incredible during all this. And I want to thank you for everything that's going on. And I'm wondering, as a finishing note, if you could, maybe if you have any thoughts of where research may, like what we might see in research as we leave this era of COVID, because I think this has really shone a light on the need of rapid evidence-made decisions for policymaking, and how this will be transferable once, not necessarily just for the pandemic, but not abusing it in terms of taking shortcuts for anything in life, but when we need it, having these opportunities, and how this will continue as we head out of this pandemic specifically.
I think there's a big piece of advocacy here. I think, and is certainly some work that I personally would like to do, and have discussions with other Cochrane folks about having that, understanding what evidence-informed decision making is really, even at grassroots. And I think, from a public perspective, a lot of folks are really interested in the science, right? Because it's affecting them, it's affecting everyone, it's affecting society. I mean, look how much society has changed. And so I think there's a great opportunity, right, to really engage with that. And to tool up people, if you will, right? And understanding things a little bit more. I think one aspect of the pandemic that's made it really clear is we can hit the ground running. I mean, look at vaccine development and the fact that information, that they're ready to roll things out. I mean, is that not amazing?
Unprecedented the time.
So it really is. And kudos on science, really. And it's been a collaboration too. It's also been about regulators, right? It's about, reducing time to be able to approve vaccines and that. And so I think it really has shown, I guess, the extent of plasticity that actually us with our humans and our systems can have to be able to advance science. Yeah, it's quite interesting.
And I think it's also amazing how much of a light it's shone on how much we need public health and how much we need these organizations and these systems implemented. And there, at least in Ottawa, there seemed to be, prior to all this, there was a lot of health cuts and there was a lot of frustrations around that. And then people would look at science and say, oh, well, it takes so long to do anyways. And it was just sort of left on the back burner. And this is really shining a light on how much we need all this and that we can't neglect it. And we need the funding and what can be done if we have these barriers taken away, how quickly vaccines can be made for things like this. And it really is wonderful.
Yeah, that's for sure. Definitely.
Well, thank you so much for speaking about this. And I'm going to link both the recommendations onto our show notes and the links to the guidelines and everything. This work is incredible. Thank you so much for it all.
Well, thank you for having me. And again, I am one person and we are one group at Cochrane Canada, obviously. And there's so much more that's actually taking place through Cochrane. So for folks who are interested, the editor-in-chief of the Cochrane Library has actually released a supplement to the Cochrane Library that is speaking very much to the different groups and what they're doing to tackle the pandemic. And so for those of you interested in it, please check it out and read the short reports of what everyone is doing.
Yeah, I'll add all of that to the episode so that it can be easily found for everyone. So you can just click the links and we'll have them below. But thank you so much for all of this.
Thank you.
Have a great day.
You as well.
Thanks for listening. I hope you enjoyed hearing more about research in the age of a pandemic that requires timely advice for decision making. Cochrane is combating COVID-19 by continuing to promote evidence-informed health decision-making, and not only have they released recommendations on rapid review methods and published many rapid reviews throughout the pandemic, but they have also launched a recommendations map that is essentially a one-stop shop for all information regarding COVID. It launches today, Monday, December 14th, and I'd highly recommend that this becomes your go-to for any questions that you may have. It is both easy to use and understand for anyone, whether you're in healthcare or not. I've attached all the links to the show notes, so make sure you check it all out, and don't forget to rate, review, and leave us your thoughts and comments. Thanks so much, and see you all next Monday.